much. Thank you for your attendance. This was an informal meeting of a high-level group, so it was not a council meeting, which I chaired along with Minister Lorenzin on behalf of the Italian presidency, also because of the developments regarding the Ebola crisis. And first of all, I would like, during this conference, to summarize what the ministers and the Commission are doing and intend to do in the very near future on this question of Ebola. First of all, the ministers wanted to give a message of reassurance to our citizens that we are ready to step up our efforts and reinforce our preparedness and response. And there were 2 points which were deeply discussed and mentioned by practically all the ministers. We had 21 ministers from the member states, apart from Norway, Switzerland, the WHO regional director, and also the Director General of ECHO, that the European Union is doing its part in the Western African countries to help these countries to strengthen their health systems and be able not only to contain the disease today, but also future diseases in the future, which will rise again. I just mentioned one figure. I won't be pedantic by mentioning too many statistics. The European Union has already assigned 180 million euros to these countries to strengthen these systems. Not only because I believe that the European Union has a moral obligation towards these African countries, and that's the primary aim, but also because containing the disease in these Western African countries is of primary importance to these countries and their citizens, and also to us to contain the spread as much as possible. And I must also underline those whom sometimes we forget, the selfless work of health workers, mostly Europeans, who are in these countries, some voluntary, some doing it in a purely altruistic way, and these are the real ambassadors of the European countries in Western Africa. So first of all, the member states, at least the majority who intervened, want to reinforce screening at the point of exit in these African countries. There are conflicting reports as to whether this screening is effective or not. It is being done, but the problem is, are they being effective? So, along with WHO, the Commission will immediately undertake an audit of exit screening systems in place in the affected countries, Liberia, Guinea, and Sierra Leone, to check their effectiveness and reinforce them as necessary. This was unanimously one of the unanimous opinions expressed by member states. Secondly, member states intend to better coordinate the national measures at entry points, in particular for direct connections at airports and ports. So whatever system the member states choose, whether relying only on exit screening, or else, as some have already done, introduce screening measures at entry point, there was a commitment, although this was an informal meeting, but they expressed a commitment to coordinate, to better coordinate these national measures. I would like to make one observation. The decision whether one introducing screening at entry point, or what kind of screening, because there are different kinds of screening at entry point, remains a sovereign decision of sovereign states. Neither the Commission nor a majority of member states can impose its will on other member states. But we agreed to coordinate the national measures at entry point. And here are some of the examples which we will strive to try and introduce in the shortest time possible. First of all, common protocols and procedures on passenger questionnaires, common contact tracing forms, and contact tracing procedures. So there was this expression that the Commission should continue to work with the aim of arriving to an agreement on common protocols and procedures, so that we would not have different protocols and procedures as regards the information which we collect from passengers arriving from this area. Secondly, we have a lot of information contained in the visa information system. Don't forget that anyone coming from, if he's a citizen or she is a citizen of these three countries, needs a visa and needs to apply for a visa to enter the European Union. So there is the information in the visa information system. Whether you are in Schengen or not, it's irrelevant to this fact. You still need a visa. And also there is the information of the transport carriers. And within the context of what is permissible at law, national law and EU law, we shall be able, by having more information, whether it will be a database one has to see, to anticipate potential arrivals of diseases infection. All member states were of the opinion that we need to reinforce information and awareness, and therefore indulge in awareness campaigns at all entry points of the European Union, which information will be addressed to passengers, to the crew, to airline crew, to all airport staff, and first-line healthcare workers. And in particular, we need to enhance information given to travelers from the affected countries so they know what to do and where to go if symptoms arise. On infection control, how can we collaborate further as European Union so that we become more organized on infection control? I remain of the opinion, as most member states and their experts are of the same opinion, that the risk of the spreading of the disease in the European Union remains low. Of course, there will be cases, but the chances of that disease spreading in the European Union remains low. But I want to draw this difference between having a case and having that case spreading. So as regards spreading, the risk remains low, and this was confirmed for Europe even by WHO a few days ago. So we will have this workshop on the 4th of November to exchange best practice in infection control. And our idea as a Commission is to propose a voluntary network of clinicians for the treatment of Ebola at EU level. And this will complement a similar network which has been recently established by WHO. Evacuation. Of course, medical evacuation is important for a very simple reason, that those who are working in the arena, those who are working, the health workers from Europe who are working in these Western African countries, need some kind of assurance that if something happens to them, they would be treated not only immediately in the affected countries, and we are working even, and some member states are working even in this regard. By the way, when I mentioned the 180 million euros assistance of the EU, this is from the Commission. So it does not include the assistance which different countries, Italy and other countries, are assisting these countries themselves. That is over and above. So we need this voluntary network of clinicians I told you already about. On evacuation, there was an increased interest on the part of member states to engage in a coordinated manner in medical evacuation. Till now, there has been medical evacuation, mostly of one's own citizens, or else of UN health workers who have been treated in different countries. The Commission is expected, as regards medical evacuation, in the coming weeks, to sign a framework contract with the US State Department so that it would be able to use the planes used by the US State Department for medical evacuation of EU health workers. And I would like to say also that Commissioner Georgieva and ECHO are working hard in this respect, and they have already put a system in place. This is their responsibility, but of course they coordinate with Sanco as well, and I hope that with this agreement we would be in a better prepared position just in case we would need to evacuate much more than we have evacuated already. And finally, we shall examine the feasibility of joint procurement for protective gear and possible medical treatment when these are available. And to this end, the Commission will explore this avenue and continue discussions with the health ministers in the Health Council. So I have made a list of the positive concrete measures which the Commission will take, apart from those which have already been taken, what the ministers really agreed on. So I tried to draw the least common denominator to show where the consensus is heading, and each time that we implement one of these measures, we shall also make it publicly known.
I would like to express my appreciate. I appreciate the great participate for all the minister, all the state member, and Tonio. When Antonio and I have called for today this meeting, as the Ebola scenario has been rapidly evolving from September 22. Therefore, is essential to intensity coordination among member states, share information and develop prevention measures within Europe and on a global scale. A number of issues have been addressed with our colleagues today. First and foremost, movement of passengers, both for direct and indirect flight from West Africa, movement and treatment of patients with the symptom, as well as patients without symptom within Europe. The third things that we discuss is about public opinion in Europe and the measure to contract the panic spreading among European citizens based on real grounds. So it's really important for ministers to give a message of reassurance to our citizens that we are ready to step up to the plate and reinforce our preparedness and response. So we want to reassure our citizens, but to give the clear information, really with the transparency. This is very important for us, and so it's important to coordinate our action, our plan in Europe and out of Europe. So I think this day is really important before the 4th November. Then we can coordinate better our plan in our countries to check our port to directly fly from West Africa and indirect too. And I believe that we can win Ebola in West Africa. Is our first issues, and it's important to be in West Africa for the Europe. So at the same moment, it's really important to explain at our citizens that we have not a real risk to have an epidemic in Europe, in our countries, but to prepare it, if it's possible, to have one or two isolated cases. But we can fight against it. We have good hospital, good system, and good doctor to treat our citizens.